Good morning. I am Dr. Ravi Shankar from Dr. Dang's lab, and in this video we will discuss biomedical waste management. Importance of biomedical waste management. The waste that is generated from the hospital or a lab carries a higher potential for infections and injuries. Inappropriate and inefficient disposal of biomedical waste can lead to infectious hazards, as you can see in this video, where waste is recklessly discarded and the same is disposed in an open garbage area, exposing both man and animal to the biomedical waste, and further leading to environmental air, land and water pollution, not only to the current generation but also for future generations. What should we do to prevent this? Strictly follow biomedical waste management, which starts with segregation. Let's do it. The Ministry of Environment and Forests in BMW Guideline 2016 gave 4 categories of biomedical waste: yellow bag, red bag, a white or translucent sharp container, and a blue container. The waste containers have plastic bags labeled with biohazard logos and are autoclave stable and non-chlorinated, as you can see on the left side. Containers have well-fitting lids operated by foot pedal, as you can see in the picture. On the right side, the white sharp box is translucent to show how much it is filled, and puncture proof as well as leak proof. Biomedical waste rule does not specify any specific color coded bag for general waste segregation. We in our lab use black bags for general waste, as you can see on the right side on the top picture. Now let's come to segregation. What goes into a yellow bag? Human tissue, placenta, umbilical cord, organs, body parts from OT, amputated limb, animal body parts, organs, tissues from animal house, soiled cotton, pad, dressing materials and plasters, used mask, plastic apron, head cap, leggings, used HIV kits, blood bag, discarded linen, mattresses, beddings contaminated with blood, discarded medicine and cytotoxic drugs, dry chemical wastes, lab cultures, stocks, residual toxins, dishes, and devices used for culture. Our waste disposal services send yellow container contents for incineration. However, chemical liquid waste such as discarded disinfectants, liquid from housekeeping related activities are pre-treated with 1 to 2% sodium hypochlorite for a contact time of 20 minutes and then discharged into a separate collection system, which leads to effluent treatment system. In the red bag, all infected plastics like IV sets, plastic IV bottles, syringes without needle, needle caps, gloves, blood sets, corrugated drains, Eurobag, all tubings like ET tube, Ryle's tube and drainage tube, all catheters like urinary, suction and cardiac sheath, and vacutainers. Red container contents are autoclaved, followed by shredding and mutilation, and then recycled by our waste disposal services. In the white sharps box, which is also a puncture proof box, we discard needles, scalpel, all type of blades, lancet, lumbar puncture needle. In the blue bag, which is meant for glass items, penicillin bottles, all glass bottles like solution bottles, syrup bottle, IV bottles, used vials, broken ampules, metallic implants, glass test tube, slides and cover slips can be discarded. Remember, yellow has blood and tissues dead. Infected plastics and rubber go in red. Sharps and containers lockable and white. Blue cardboards for glassware, that's right. The color black for general waste. Don't forget this in your haste. Another way of remembering this is पीले बैग में पीले में पट्टी, सर से सफेद में सुई और स्कैल्पल, लाल में लचीला प्लास्टिक, ब्लू में बोतल या फिर गत्ते में ग्लास. According to WHO, Nearly 85% of all waste generated by hospitals or labs is general waste, and only about 10 to 15% is biomedical waste. Reduce, recycle, reuse. For one man's trash is another's treasure. Using modern technology, only 5% of incinerable waste is converted to ash that goes to landfills. Infected plastic waste is sterilized and nearly 50% is brought back into circulation after treatment. These are first converted to plastic granule and transformed to newer plastics such as bags. About 60% of sharp waste are melted in furnaces and reused as part of stainless steel products. And nearly all glass waste are recycled after treatment and melting in foundries. Let's revisit what we just learned through these MCQs. How much of waste will come under biomedical waste? 5%, 10 to 15%, 25 to 30%, or 85%? Answer is B, 10 to 15%. Lab personnel uses PPE starting from head cap till disposable shoe covers. The gloves are soiled during processing of a sample, and there was also an unexpected spill during processing on the apron. Tell the appropriate BMW management. Answer is all PPEs, whether soiled or unsoiled, should be disposed in yellow bag. An intern was asked to infuse 1 unit of whole blood for a patient with shock. Tell the appropriate disposal methods that the intern must use after infusing the patient. Answer is C. Blood bag should be disposed in yellow bag and IV blood set should be disposed in red bag. Nursing sister finds expired chemotherapy drugs stored in glass ampoules in RCC ward. She tells the sister in charge to dispose those expired drugs. The sister in charge is confused regarding the disposal. Suggest. Answer is D. Chemotherapy drugs has to be disposed in yellow bag. According to Rules 2016, the biomedical waste management should be done. Answer is C. Outsource it if the disposal site is within 75-kilometer radius from the hospital. Which among these waste is not included in the biomedical waste? Is it expired medicines, laboratory cultures, lead acid batteries, e-waste, or is it E, both lead acid batteries and e-waste? Answer is yes, both lead acid batteries and e-waste do not come under biomedical waste. The last question is, bags used for biomedical waste management should be. Answer is B, plastic and non-chlorinated.